This lecture is going to accompany Chapter 1, Principles of Pharmacology. This is a heavy chapter. It's not very long. It's about 38 pages or so, but it's pretty heavy. And I recognize that. And so I'm going to highlight in this video what you really need to focus on when you're reading this chapter. I'm going to talk a little bit about the DSM section at the end, but right now let's just kind of jump into the textbook. I like on chapter 4 in describing what pharmacology is. I think it's pretty simple. It's straightforward. This is the study of substances and what they do and how they affect our body, how they affect our emotions, how they affect us, not just physiologically at a sort of more of a cellular level, but also how they affect our behaviors, how they affect our actions, etc. I like that your textbook goes into, if you go down to the middle of the page, goes into a little bit of our reliance or our desire for more herbal medications. And I think this is really relevant to us working in addictions. It's not going to be uncommon for you to hear your clients say, I'm really fearful of or worried about taking medications for depression or medication for maybe medicated assisted treatment for opiate use, because maybe they have this stigma or this negative feeling around substances made in a lab versus herbal substances. And I think that's worth us listening to. Doesn't mean we need to buy into it. It certainly does mean that we need to be advocates and we need to inform our clients. But anyway, this sort of goes into a little bit. Certainly know the distinction and the definitions of neuropharmacology. What does that mean on, like I was talking about, on that cellular level? And then is certainly psychopharmacology for us. So how does that affect our emotions? How does that affect our mood? How does that affect our behavior, and all the things that certainly go into substances that have that level of effect on us. And then, of course, neuropsychopharmacology, sort of combining the two, how, the effects of these chemical substances that they play on our behaviors, and certainly tying into environmental factors. It's a pretty interesting study, if you ask me. Going into drug effects and drug actions, you need to know about this. You need to know what the therapeutic effect is. What's the desired, what are we hoping to gain? And by we, I mean, what are we hoping to gain, when we talk about substances? So if someone's taking an illicit substance a drug, what are they hoping to gain? If we're talking about medications that are prescribed, what is the desired outcome? And oftentimes, medication will be prescribed so an individual can stop using illicit substances or drugs of abuse. And what's important for us to know is, what do we hope to gain? Well, in the case of medication-assisted treatment, let's say for opiates, we're hoping that and we'll talk about this in a little bit, but we're hoping that some receptor sites will be blocked, so that the substances the opiates don't have the same effect, and giving the client maybe a better opportunity to get off of those substances in whatever way they choose, be it through a recovery program or a combination of recovery program and medication-assisted treatment, behavioral changes, therapy, etc. It's important for us to talk about the placebo effect. And your book talks about Pavlovian conditioning. And what's interesting about placebo effect for us from an addiction standpoint is that oftentimes you'll hear clients talk about the idea that they feel the effects of a substance before they even take the substance. I use this example all the time. This is one that I heard from some of my clients. The idea that just picking up the phone to call a drug dealer made them feel instantly better, or made them instantly feel the effects of the substance. Getting on, hanging up the phone and knowing that a drug dealer is on their way, or that you have you have access to a substance tricking your brain into thinking that you are starting to feel the effects of that substance. This would certainly be an example of that Pavlovian conditioning and certainly describe this type of a placebo effect. The second type is the explicit expectations of outcomes. So the idea that I think or I know I'm going to feel a certain way makes me believe that I will even before taking the substance, or can kind of trick me into feeling that way. Trick is probably not the best word, but make me feel that way before substance is introduced. Or just a more, in your book talks about having a more optimistic outlook, shows a more enhanced placebo response. And I think that's a really good way of putting that. Those are not the only two placebo effects, certainly. So social learning, being around substances and being around people who take substances, you get the idea of this is how it's supposed to feel and look and how you're supposed to act, maybe even on it, or just the idea that it is commonly known that this one substance can alleviate anxiety, and so you take it with the understanding that it'll alleviate anxiety, and thinking that it will is enough of a powerful enforcer to make you feel that you are less anxious. And that's yet another one of those types of a placebo effect. Let's see. So here we go. And then, of course, there's genetic, the sort of genetic variations in placebo can be another type of placebo effect. I'm going through my book also as we're talking about this. If you go on if you go on page 7, the section that talks about pharmacokinetics is also really important. Here we go. So pharmacokinetics, routes of administration, absorption, distribution, binding, inactivation, and it's incredibly important for you to know the impact of or the effects of how someone takes a substance. If someone is snorting a substance, what does that mean on the body? If someone is injecting it intravenously, what does that mean? If someone is getting the substance through, I know this isn't pleasant, but through rectal administration, and that certainly does happen. Wellbutrin has been known to be abused through being administered rectally, and it offers a very specific high. So knowing how a substance acts and interacts with your body, and certainly the fastest way to get to a high versus, in connection with a certain substance is incredibly important. Going further, the absorption and distribution. So, how is it absorbed? When does the individual start feeling the substance? And is it because it's being absorbed through their stomach? Is it because it's being absorbed through their intestines? Various drugs do various things. And then, of course, binding. This is when we talk about receptor sites. And we'll talk about receptor sites in the next week, no, maybe 2 weeks from now, I believe, when we start talking about dopamine and serotonin. But, how is this substance acting on the receptor site? And what is it doing? Is it blocking it? Is it enhancing it? Is it pretending to be a naturally occurring neurotransmitter? These are all really important pieces here. Going on. Oh, and then how is it excreted? How do you eliminate these substances? Kidneys, being filtered out through the kidneys, in the liver usually, and then coming out through the urine, or feces is the most common way, of course, but that's really important to know. I like to keep these videos at about 15 minutes, and unfortunately, that doesn't give us a long time, but I know y'all won't really watch them past 15 minutes. Let me kind of jump through here. Again, this is, how is it being administered, absorption, IV drugs. When we talk about IV drugs, we talk about intravenous injection. Most of us think about heroin. We talk about oral administration. Most of us think about cocaine. Trying to think, inhalation. So when you're talking about THC, smoking something. Again, just trying to sort of go through these. Sublingual. This is important when we talk about medicated assisted treatment. So there are some medication assisted treatment options that are sublingual. So they go under your tongue and they absorb that way. And then some medication assisted treatment is not administered sublingual, but that's important for you to know. And we'll talk about that when we talk about medication assisted treatment, but it's important for you to read up on this section as well. Let's see. I want to make sure that I keep going. Some of this is not necessarily important for you. I really like this chart here, advantages and disadvantages of the routes of drug administration. And it goes through, whether you're going to, again, are you snorting it? Are you injecting it? Is this, being injected into a vein? Is it being injected to a muscle? Are you inhaling it? And then again, here's the advantages and disadvantages of doing of these types of administration, drug administration. I'm not going to spend too much time on absorption. This is important. The sex and size of the individual is really, really important in how we absorb and how we process and metabolize substances. Sorry, guys, I hate to keep jumping through this, but I want you to pay attention to blood-brain barrier when you get to that section. It's on page 16. This was really important. This is how substances get to our brain and what protective factors we have and what protective factors we don't have and what substances sort of penetrate that. Teratogens, I mean, a teratogen, you're going to have there's a question about this, I believe, on your exam, but a teratogen is any sort of substance that creates an abnormality in a developing fetus. And so when we talk about people who take substances while they're pregnant, women who are using while they're pregnant, of course, anything that they take is going to then be a teratogen. This is an important word for you to know. And again, I believe in sort of speaking the language. So when we talk about individuals who use during pregnancy, the substance they use is certainly would be called a teratogen. Half-life. I have a video that describes half-life. I don't want to go too much into it in this lecture video here because I've got a really good video where they talk about sheeps, but essentially it's the amount of time that half of the substance is removed, and then it's not 50% is removed, and then in that amount of time the rest of it is removed. It's 50% of it is removed in a certain amount of time, and then in that certain amount of time 50% of that 50% is removed. So again, you'll see in the video that describes half-life. Make sure you watch that video on half-life. It's a very good descriptor and a very good description of what a half-life is. I don't want to hold you up on that as I'm going through here, just making sure I'm checking on things. There's half-life. Here's half-life for some substances, not all of them, but some substances. So again, the amount of time that it takes for half the substances to agonist and antagonist. Where am I? We need to talk about that for a little bit, although I don't have a ton of time, but we're going to talk a lot more about these, but now we're getting into receptor sites and neurotransmitters. And then here when we talk about agonists and antagonists, one of them attaches to a receptor and can produce this effect. Another fits and blocks. I'm running out of time here. I might add another video right after this.